This video is going to be on the clinical signs of anemia. All of the clinical signs of anemia we can attribute back to a low hemoglobin concentration. Hemoglobin is the molecule that delivers oxygen to the tissues. So if there's less hemoglobin, then there's less oxygen delivery to the tissues, and this is known as tissue hypoxia. The tissues respond by saying, we need more oxygen. So the body undergoes compensatory mechanisms to increase blood flow and increase oxygen to the tissues. The first of which is that there can be an increased heart rate, so tachycardia, increased stroke volume, and as a result, there's an increased cardiac output to make the blood flow faster through the blood vessels. But in doing so, it actually results in turbulent blood flow, and this can result in a heart murmur or a cardiac murmur. This is also known as a physiologic or functional cardiac murmur because it's not pathologic. It's not due to heart disease itself, it's due to something else outside of the heart, a compensatory response. A second compensatory mechanism is that the animal can increase their respiratory rate. This is known as tachypnea. When there's an increased respiratory rate, there's increased oxygen flow to the lungs and then to the blood. A third compensatory mechanism is that the patient or animal can redistribute blood flow to various organs by vasoconstriction and vasodilation. So what happens is there's redistribution of blood flow to the vital organs, such as the brain, and away from non-vital organs, such as the skin. So there's cutaneous vasoconstriction, which reduces blood flow to the skin, which can result in pale mucous membranes. Now there's a second mechanism for the pale mucous membranes, and it has to do with the color of hemoglobin. Hemoglobin is red, so if there's less hemoglobin, there's less red to the blood, which can also contribute to the pale mucous membranes. So now I'll go back to tissue hypoxia for a moment. Tissue hypoxia results in less aerobic metabolism, meaning that there's less oxygen available for energy production. And this results in lethargy in the animal, so tiredness in the animal, and they can be more easily tired with exercise. This is called exercise intolerance. Now, the onset of the anemia and the severity of the anemia dictates how severe the clinical signs will be in the patient. If there's chronic onset, then they'll have less severe clinical signs than if it was acute onset. And if it's a more severe anemia, of course, they'll have more severe clinical signs than if it was a mild anemia. So there you go. Those are the clinical signs that we attribute to anemia. The most specific thing that we look for to identify anemia in the patient on physical exam is pale mucous membranes, because a lot of these other clinical signs can be seen with many other diseases.